I'm Krista Hinson, Vice President of Government Relations for SCHA. I'm going to give you an update of what happened during the 2022 legislative session. 2022 was the second year of the legislative session, which means any laws that were not passed this year will have to start all over at the beginning of the committee process in 2023. This year, SCHA's priorities focused on improving the healthcare workforce landscape, enhancing the state's behavioral health system, modernizing South Carolina's Certificate of Need process, and ensuring protective measures against COVID-19. First, let's talk about the issue we keep hearing about from our members, workforce. COVID-19 contributed to worsening the workforce shortage for hospitals as some workers left the industry altogether. However, we were grateful to pass a few new tools to help hospitals weather the storm, like improving flexibility for physician assistants and APRNs to delegate directly to certified medical assistants, and permitting medical assistants to administer medications in intermediate care facilities and nursing homes. Putting the SC WINS program into permanent law to strengthen the healthcare workforce pipeline and increase access to $17 million in scholarships. Expanding telemedicine for social workers and counselors to provide their critical services for addiction and other mental health services for patients. Simplifying the process for certain clinical licenses, and funding the recruitment and retention of nurse faculty to increase capacity for the state's nursing programs. In addition to workforce, COVID-19 also intensified issues for the state's behavioral health system. This year, we extended the timeframe for individuals who have been found unfit to stand trial from 60 days to 180 days so they can better understand the proceedings against them. We helped enact the Psychological Interjurisdictional Compact, also known as PsyPact, which allows psychology licensees from other states to be recognized for practice here, improving access to needed mental health services. We established a program allowing distant family members and friends to serve as foster parents for those in need of adoption to improve adoptive services. Altogether, this year's budget includes more than $61 million in additional funding to enhance the state's behavioral health system and access to substance abuse treatment. We continued to work with lawmakers on issues arising from COVID-19 and COVID-19 vaccine mandates. A bill that would have originally resulted in millions in penalties for healthcare providers that required vaccines for their workforce was ultimately amended to allow hospitals to implement vaccine policies as needed. We also worked closely with state policymakers this year to try to reform South Carolina's Certificate of Need program to meet the needs of today's modern healthcare system. And while we were unable to strike a compromise with those aiming to fully repeal the program, we will continue to make good faith offers to improve efficiency and protect access to care in rural and underserved areas. In the aftermath of the Supreme Court ruling in Dobbs v. Jackson, we will continue to provide input and feedback to lawmakers on the impact of their proposals on healthcare providers and the patients and communities they serve. South Carolina is among the states that have passed a fetal heartbeat law that bans abortion when a fetal heartbeat is detected. However, recently, the South Carolina Supreme Court temporarily blocked the law from taking effect. The House and Senate continue to consider new abortion measures, and SCHA will be there to monitor their proposals and share the impact on the state's hospital community. For more information on these bills and other legislation that passed the General Assembly this year, visit the link below.